most about. So says U.S. Senator Bill Cassidy, who's also Dr. Bill Cassidy. He was in hepatology and gastroenterology as a physician, distinguished physician. He is now the United States Senator from Louisiana and a member of the Senate Health and Finance Committees. Senator Cassidy, it's an honor to have you on the show. You've just created a white paper that puts forward a bunch of fresh ideas on what we can do to address the problem that the American people care about most. And as you travel around your state, what do they care about most?
Hey, Michael, thank you for having me. When I'm in a town hall meeting, people want to know about opioid epidemics. They want to know what can they do for their friend or loved one who has mental health issues. They want to know what about the high cost of medicine, all of what I've just said is related to one another. For example, my insulin continues to go up. I cannot afford it. I've got a $6,000 copay. I can't afford my insulin. That's what they want to know about.
And so tell the folks out there in your white paper in fixing our medical care system, what would help most in terms of reducing the cost of premiums and copays?
There's so many things. Let me start with, let me just start 1, 2, 3. First, price transparency. Imagine that you knew that if you went to this pharmacy, the one drug would cost you $44. And if you went to that pharmacy, it cost you $700.
I think I know which one I'd go to.
I didn't make up those numbers. That comes from a Consumer Report article where they had secret shoppers called different pharmacies saying they were going to pay cash, and one would be $44 and the other would be $700. Now, we need to have price transparency, not just that you can knock on the door, give me the price, but no, you can actually log in, you can see the price, and just like you go one store or another to buy white sheets on a Memorial Day sale, you go to this one because it's got the better price for the drug you want. One idea. Second idea is we need to do a cost-benefit ratio of new drugs. There's a medicine out there that's just two generic medicines put together that would cost you $20 if you bought it over the counter. That's Motrin and Pepcid put together, $20, but is sold as a prescription for $2,600 a month.
Wow! Now, how does that even happen? That you have that kind of difference?
Some company put it together. It's called Duexis. They put it together in a little bit of a different dosage form. They got. It's a brand new medicine, even though it's two generics put together, but because it's put together, it counts as a new medicine, and they sell it for $2,600. They give a patient a coupon, so she doesn't know how much it costs because her insurance picks it up above a certain amount. You're still paying for it. You're paying for it with higher premiums, and $20 goes for $2,600. The company does very well, but you pay that much more in premiums or out of pocket. The patient should know that. The patient should get the cheaper medicine.
You've heard everybody out there undoubtedly the phrase, make America great again. Bill Cassidy, Dr. Bill Cassidy, who's a member of the U.S. Senate, has a plan to make health care affordable again. We've posted it up at our website at michaelmedved.com. It's one of the most thoughtful and substantive pieces of prospective legislation regarding our healthcare system that I've seen. It's at michaelmedved.com. Has there been some bipartisan support for some of this? I believe there has there not?
Absolutely. On the price transparency, where if the doctor orders a X-ray for your child, you would know the price before you go to get it done as opposed to find out 6 months later. We got 3 Republicans and 3 Democrats. We've all combined to begin this effort. We'll be introducing legislation soon. On the insurance stabilization, I'm just mentioning 2 things that others have done, which is Lamar Alexander and Patty Murray, the senator from Washington State, as well as Bill Nilson and Susan Collins came up with legislation that, if implemented, could lower premiums by as much as 40%. Unfortunately, Bill Nilson, Patty Murray voted against it on the Senate floor. I'm so sorry about that. They collaborated, they came up with a good product, and then they voted against it, and now folks don't get the benefit of lower premiums. But I would take those pieces of legislation generated by others, advance that, so we do lower premiums by 40%.
Hey, you can find out all about this by going to our website, michaelmedved.com. Senator Cassidy, it's a pleasure speaking with you. I hope you'll come back on the show so we can discuss this more.